I think snoring and nasal blockage are related in a way. There is a condition called upper airway resistance syndrome, which causes snoring. And upper airway resistance syndrome simply means that the when we are breathing, the air has to go through a lot of resistance within the nasal cavity, and that resistance may be coming from the nasal passage being narrow or being very swollen, and that narrowing and swelling can be due to anatomical problems inside the nose, such as a deviated septum or enlarged turbinates, or it can be due to certain pathologies like nasal polyps or growth or infection inside the nose. So having these conditions can sometimes predispose the patient to snoring. But there are several other reasons patients snore. It can be due to enlarged adenoids that they have, particularly children, or it can be due to very large tonsils that they have, or it can be due to a very patulous soft palate or a very large tongue. There are several other reasons, and yes, nose also contributes somewhat to patients snoring. The role allergies play in snoring is they cause mucosal edema, and they can also predispose the turbinates to become very swollen, again creating a situation where there is a upper airway resistance syndrome, and that contributes to snoring.